That frustrating moment when hip pain wakes you up is absolutely maddening. You are trying to find that perfect spot to finally fall asleep on your side, and boom, that sharp, aching pain hits you in the hip and inner thigh, ruining your sleep night after night. You twist, you turn, you maybe even give up and try the couch, but nothing seems to help, and you wake up feeling stiff and exhausted. Why is it that every time you lie on your side, your hip and inner thigh feel like they are being punished? I know this struggle firsthand because I went through the exact same thing for years, constantly searching for a solution that did not involve just popping another pill. As a physical therapist who has been helping people over 60 regain their movement and comfort for over 25 years, I can tell you this: the solution for your agonizing hip pain when side sleeping is not drugs, it is not surgery, and it is not some complicated, expensive gadget. It comes down to a few simple, targeted movements you can do right at home starting today. I want you to stick with me through this entire video because I'm going to show you exactly how to fix your hip pain and start sleeping comfortably tonight. Do not waste another moment suffering. Comment your name and where you are watching from right now, and let us get you sleeping soundly again. When you are dealing with hip pain at night, it is so easy to fall into what I call the RIPS trap: resting icing, getting injections, taking pills, and even thinking about surgery. I have seen so many people over 60 go down that path because it feels like the only option, but none of those things actually train your body to work the way it is supposed to. What we want to focus on is functional training, because that is what teaches your muscles to stabilize your joints and move your bones in a comfortable, controlled way. This is where the idea of ATM, always think muscles, becomes so important. Instead of chasing scary diagnostic names or feeling like a victim of arthritis or labrum tears or impingement, you start asking what your muscles are doing or not doing. When you lie on your side, your hip muscles need to hold the joint in a balanced relationship so the bones are supported rather than collapsing into each other. But most people, especially if you spend hours sitting during the day, have very weak side hip muscles. They are underused, soft and tired, and then at night, you lie down and those same weak muscles get stretched a little more and asked to relax even further, and they simply cannot handle it. That is why that deep aching pressure shows up the moment you settle onto your side. All that time spent sitting makes the muscles on the outside of the hip less responsive, while the tissues on the inside feel tight and irritated. It is not that something is torn or damaged, it is that the muscles do not have enough strength at the right length to support you. Once you understand that the pain is coming from weakness and not age, you can finally do something about it, and that is where the exercises I will show you in a moment become so powerful. The first thing I want you to do is learn how to wake up the muscles that are supposed to support you when you lie on your side, and we do that with an exercise called the side lying abduction at a 90-degree angle. This movement is simple but incredibly effective, and if you have been dealing with that deep, aching hip pain at night, you are going to feel very quickly why this matters. I want you to lie down on your side on a firm but comfortable surface. If your hip is already sensitive, you can use a small cushion, but do not worry if it feels a little tender, because that will improve as your muscles get stronger. Bend both knees so they come toward your chest at about 90 degrees. This is roughly the same position most people are in when they sleep on their side, which makes this exercise directly useful for the problem you are trying to fix. Rest your head on your arm or on a pillow and let your top hand relax in front of you. Now your job is to lift the top leg straight upward in a slow, controlled motion. You are not kicking, you are not using momentum, and you are not letting your legs swing. You lift straight up and you lower straight down, smooth and deliberate. Think of moving through thick, warm water, not air. The muscles you want to feel are in the back of your hip, the glute max and glute med, the ones that sit right behind the side seam of your pants. As you lift, you should feel a gentle tightening or burning in that area, not in your lower back and not in the front of your hip. If you do, slow down and focus on the idea of lifting from the back pocket area. Most people over 60 discover very quickly that these muscles are far weaker than they realized, especially if you spend a lot of time sitting during the day. That sitting turns these muscles quiet and sluggish, and then the moment you lie on your side at night, they cannot support your hip the way they are meant to. That is why this slow, controlled movement is so important. You are restoring strength in the exact muscles that keep your hip comfortable when you sleep. I want you to aim for 5 to 15 repetitions on each side. The number does not matter as much as the quality. If you rush through them, you will miss the point. The slower you go, the more those deep hip muscles have to work and the more control you build. When you lower your leg, lower it with as much care as you used to lift it. Do not let gravity take over. That lowering phase is just as important for building strength at the length your hip needs for comfortable sleep. Take your time, feel the muscles warm up. When the side you are working on starts to feel tired or heavy, switch to the other side and repeat the same, slow, steady reps. Do not be surprised if one hip feels much weaker than the other. That is extremely common, and it usually matches the side that hurts more when you lie down at night. As you work through your sets, pay attention to how your body responds. If you feel that deep burn in the back and side of your hip, that is exactly what you want. That burn is blood flow, activation, and real strength returning to muscles that have been quiet for too long. And remember this part because it matters. These exercises are not supposed to feel like fancy gym movements. They are supposed to feel like you are reintroducing your body to muscles that have been asleep. Every slow rep is teaching your hip how to support you again, so that when you lie on your side tonight, those tissues are not collapsing and complaining. Give yourself permission to go slow, to breathe through the work, and to feel those muscles engage. This is how you rebuild the support system your hip needs, so you can finally get through the night without that sharp, aching pain waking you up. However, to truly prevent your hip joint from collapsing when you lie on your side, we need to fully wake up the side of your hip. That is why this second exercise is going to surprise you: side-lying abduction with hip extension. It looks simple, but it exposes weaknesses that most people over 60 never realize they have because daily life almost never asks these muscles to work in this position. I want you to stay lying on your side just like before, but now you are going to slide your top leg back until your thigh lines up with your torso. Instead of being tucked toward your chest, your thigh is now straight in line with your body like one long piece. Keep your knee gently bent so you are not locking the joint. This position alone might already feel tight or awkward, especially if you spend a lot of time sitting during the day. Do not worry about that. That tightness is simply your hip telling you it is not used to functioning in this lengthened position. Take a breath and let your body settle into it. Once you are aligned, lift your top leg upward in a slow, steady motion and lower it back down just as slowly. Think of moving with intention, not speed. If you lift too quickly, you will bypass the muscles we are trying to reach. What you want to feel is the work happening on the side of your hip, the glute medius and glute minimus, the muscles that sit directly under the bony crest of your pelvis. These are the muscles that help hold your hip joint open and supported when you lie on your side, and when they are weak, you get that deep, aching compression that makes sleep miserable. While you lift and lower your leg, notice how far your knee travels toward the floor. In the beginning, especially for people over 60, the knee often stays hovering several inches above the ground because the muscles cannot support the motion through its full range. That is completely normal. One of the clearest signs of progress in this exercise is when your knee starts getting closer to the floor over time, showing that your hip is gaining both strength and functional length. Just like in the first variation, you are aiming for 5 to 15 repetitions on each side. The exact number does not matter. What matters is that you go slow enough to actually challenge the muscles. You should feel a focused burn along the side of your hip, not pain in the joint itself. If your leg shakes a little as you lift and lower, that is a good sign that you are working in a range your muscles desperately need. When you finish your set, switch sides and give your other hip the same attention. Many people discover that the side that hurts more at night is the side that feels weaker in this position. As you practice this movement, you are training your hip to stay open and supported rather than collapsing inward when you lie on it. This is one of the biggest keys to getting rid of hip pain while side sleeping. So be patient, go slow, and give yourself credit for every inch of progress. Your hip is learning how to support you again, and that strength is what will help you finally settle into sleep without that sharp, nagging ache waking you up. For the third exercise, we are going to target a part of your hip that almost no one trains on purpose, the inner thigh, and strengthening it can make a huge difference if you feel that deep, tight pulling or pinching along your inner thigh when you lie on your side. This movement is simple but surprisingly eye-opening because it shows you just how weak this area can become after years of sitting and bracing. I want you to stay lying on your side, but this time, slide your top leg forward and plant that foot firmly on the ground in front of you. This leg is only there to keep you steady, so do not worry about making it perfect. What matters is the leg underneath. That bottom leg is the one doing all the work. Let it relax for a moment so you can feel where it sits naturally. Then slowly lift the lower leg upward using the muscles on your inner thigh. It is not a big lift, and it should not feel like you are straining your hip flexor. You are thinking about drawing the thigh bone toward the midline of your body, like you are gently scooping it upward from the floor. The muscles you are targeting are the adductors, and most people are shocked by how weak they feel the moment they try to lift from this area. If the motion feels shaky or unsteady, that is not a bad sign. That shaking is your body telling you that this part of your hip has not been working the way it should. The only way to change that is practice. As you lift and lower your leg, try adjusting the angle of your torso just a little. If you lean slightly back, you may feel the work shift into a different band of the inner thigh. If you lean a little forward, you may find a new weak zone. There is no wrong angle here. You are simply exploring the positions where your inner thigh struggles so you can train it to become stronger and more supportive. Go slow and steady. If you rush through it, you will miss the subtle engagement we are trying to rebuild. Aim for 5 to 15 repetitions just like the other exercises. And remember that the quality of each lift matters far more than the number. When you lower your leg, lower it with control. That part of the motion builds strength at the length your inner thigh needs to tolerate side sleeping without that sharp, tight feeling waking you up. Once you finish one side, move to the other and repeat the same slow, controlled lifts. Many people over 60 discover that one inner thigh is dramatically weaker, and it usually matches the side that complains the most at night. As you practice this movement, you are restoring balance between the outer hip and the inner thigh, giving your body the ability to hold your hip joint in a more comfortable position when you lie down. This is a small exercise, but it changes the way your hip supports you, and that support is exactly what allows your body to rest without gripping, tightening, or sending pain signals the moment you try to get comfortable. Keep the motion smooth, be patient with the shaking, and let your inner thigh relearn how to do its job. Your hip will thank you tonight. Once you have gotten comfortable with the first 3 exercises, I want you to start exploring different angles because your hip never stays in just one position when you sleep. This is where you begin training all the in-between zones, the places where weakness usually hides and where pain often shows up first at night. When you work through these angles, you teach your hip to stay supported, no matter how you settle into bed. Start by moving your leg into an intermediate angle between the 90-degree position and the extended position you practiced earlier. Lift and lower your legs slowly and pay attention to how the effort shifts. Some angles will feel strong and steady, while others will feel shaky or uncertain. Those shaky spots are exactly the dead zones we want to strengthen, because they are the same positions that tend to collapse when you lie on your side. Then try a deeper flexion position. Bring your knee closer toward your chest as if you are curling up the way many people naturally do in their sleep. Lift your leg from that tucked position. It may barely move at first, and that is perfectly fine. This angle exposes tightness and weakness that often come from years of sitting, and even a small controlled lift helps your hip learn how to support you when you sleep curled up. After that, return to your inner thigh lift and play with the angle there too. Move your upper leg slightly forward or slightly back, and notice how different fibers of the adductor muscles start working. If you lean your torso a little forward, you might feel the effort shift higher. If you lean back, it might drop lower. Every small adjustment helps you find new areas that need attention. There are no wrong angles here. Your goal is to explore and strengthen every zone your hip might move into during the night. The more comfortable your muscles become in these positions, the less your hip has to grip or tighten to protect itself when you lie down. This is how you reduce those sharp or nagging sensations that wake you up. Take your time and let your body guide you. Each of these angles gives your hip a chance to build real control, and that control is what turns a restless, painful night into one where you can finally relax and sleep deeply. Once you feel steady with all the angles and variations, you can take things to the next level by adding just a little bit of resistance. This step is not required, but for many people over 60, it becomes the turning point where the hip finally starts feeling solid and supported through the entire night. You can use a pair of ankle weights or even a lightweight plate that you secure carefully to your leg. The goal here is not to make the exercise harder for the sake of being hard. The goal is to gently overload the muscles so they become more resilient. When you add even a small amount of weight, those hip muscles have to wake up and work in a way they simply cannot without resistance. That extra challenge helps build real strength that carries over into your sleep. Put the ankle weight around your lower leg and go right back into the side-lying abduction. Lift and lower your leg just like before, slow and controlled, letting the added resistance pull you into deeper muscle work. You will feel the difference immediately. The glute med and glute minimus will have to stabilize more firmly, and the lowering phase will ask a lot more from the muscles that help you stay comfortable on your side. If you also struggle with inner thigh pain at night, place the weight gently on your lower leg and repeat the inner thigh lift. You do not need to lift high. The weight will make the small motion challenging enough. What matters most is the quality of the control. Adding resistance teaches your hip how to handle more load without complaining, and that improvement shows up in your balance, your walking, and especially your side sleeping. When your hip muscles are stronger, they stop collapsing at night, which means you stop waking up with that sharp, aching pressure through your outer hip or groin. This is how you build a hip that supports you through the night instead of fighting you. Even a few weeks of light resistance work can make a noticeable difference, so be patient with yourself and celebrate the progress you feel along the way. Once these movements start feeling familiar, I want you to understand that what you are building is part of something much bigger than just fixing hip pain at night. Your hips are at the center of how you move, how you stand, how you walk, and how you sleep. And when they are strong and mobile, your entire life feels easier. That is why I encourage you to add a few complementary exercises into your routine, because they fill in the other pieces your hips need in order to stay comfortable around the clock. Movements like hip thrusts and glute bridges are wonderful ways to build strength in the big power muscles on the backside of your hips. When you lift your hips up in a controlled bridge, squeezing through your glutes and keeping your core steady, you are teaching your body how to support your pelvis in a way that keeps pressure off your joints. Adding gentle hip flexor strengthening, even something as simple as lifting one knee toward your chest while sitting tall, helps you regain balance between the front and back of the hip. This balance is what allows your hip to glide smoothly instead of gripping or tightening the moment you lie on your side. Full hip mobility matters because stiffness in one part of the hip forces another part to work too hard, and that imbalance is often what wakes people up at night. When all the muscles around your hip can move, stretch, and support you through a full range, your body no longer feels the need to send pain signals every time you shift positions in bed. If you want a deeper, more structured way to explore your hip strength and flexibility, I always recommend starting with a simple beginner hip mobility program. It guides you through movements that reveal where your hip is tight and where it is weak, and it gives you the tools to build real strength and control. And if you have been told you have hip impingement or FAI, there are specific programs designed to help you work through those patterns without fear or frustration. What matters most is understanding that building long-term hip strength does more than help you sleep. It improves the way you move through your day. It helps you feel steadier on your feet. It makes standing up from a chair easier and walking more enjoyable. Every bit of strength you build now pays you back in comfort, confidence, and independence. Your hips are capable of far more than you may realize, and with the right training, you can give them the support they need to carry you through every part of your life with ease. You have just worked through a set of movements that go straight to the heart of why your hip hurts when you sleep on your side, and I want you to really recognize what that means for your body. Every exercise you practiced today was designed to strengthen the muscles that have been letting your hip collapse at night. By waking up the outer hip, the inner thigh, and all those forgotten angles in between, you are rebuilding the support system your body needs to stay comfortable when you lie down. These may look like simple exercises, but they target the true source of your nighttime pain. And when you stay consistent, you will feel the changes not only when you sleep, but in the way you walk, stand, and move through your day. The long-term message here could not be clearer. Strength feeds comfort, strength feeds mobility. When your hips are stronger, they stop tightening and fighting you, and your body finally gets the chance to rest instead of bracing all night long. So keep at it. Give yourself a few steady weeks of practice and notice how much easier it becomes to settle onto your side without that sharp ache taking over. If this video helped you, I would love for you to like it, subscribe, and hit the notification bell so you never miss the next step in building stronger, healthier hips. It helps more people over 60 find the help they need, and it allows me to keep creating videos that support you. Remember, pain sucks, life should not. Let's keep moving forward together.